My name is Marina Arakelian, and I'm from Boston, Massachusetts. And I've been in Armenia for just over a month now, and I'm preparing at this point to go back home. And just thinking over my time here, I'd like to share some thoughts about what my experience has been like. First of all, I'll tell you I'm a social worker. My background is in clinical social work, and I also am a graduate of School of Psychoanalysis, so that's part of my background, and I've done some teaching, but more recently I've been in a postgraduate program in infant and maternal infant mental health, and that's partly why I decided that I would do a placement in Armenia, specifically in an orphanage. I was hoping to work with the infants and the caregivers to look at the caregiving styles in institutional settings with the very young children. I was very excited to come to Armenia, and I realized very quickly that things change sometimes quickly, and when I did arrive here, I found out that it would not, in fact, be possible to work with the babies, that there had been some policy changes, and so my representative with the Armenian Volunteer Corps went to work with trying to find alternative placements, and I visited a couple of placements that were tremendously interesting. I wish I could say that it worked out immediately, that it was a good fit in terms of what I could provide and what they needed. But it did take a little bit of time. I ended up working with 3 sites in the end, the first being the FAR, Fund for Armenian Relief, and I was very pleased to have an opportunity to work with the director on a proposal for foster care, and the social work system here in Armenia is undergoing some major renovations, so it was very exciting to see what's being proposed and training programs along with that. I've also been working at the Zatik Orphanage, where I am now, and particularly working with the social workers and understanding some of their needs. And because some of the graduates are very new to the field, they were very much in need of supervision, just consultation on cases. So we've been doing seminars, teaching case management, doing assessments, treatment plans, measuring outcomes, and that's been a very rewarding experience. One of the things that I particularly enjoyed is meeting a family with many needs, issues of poverty and medical issues, things that will take many years if can be resolved to be resolved. But there's a daughter in this family who's been needing corrective eye surgery, and the social workers have been working very hard to find someone to sponsor the surgery, but unfortunately they weren't successful. I'm part of an organization in the United States that raises funds for children in orphanages, and we were able to work with the president of that organization, and within a matter of hours the money was raised so that this child could have her surgery. So a team of doctors will be coming very shortly, and this young girl will have the benefit of that. So that's a wonderful thing to feel that you could make some change in a young person's life. As I'm wrapping up my time here, it's been very rewarding, and I would encourage you to engage in the experience fully, be open to all that it has to offer, and I think that you'll be very pleased and satisfied.